So an LVAD, or a left ventricular assist device, is a device that helps support, as it says, the left ventricle. The left ventricle is one of the pumps of our heart. We have the left ventricle and the right ventricle. This supports the left side of the heart. That's the most common place the heart fails, is the left side, and this helps support it. It doesn't replace it, but indeed supports it. So patients that have advanced heart failure and that left side is not doing well, this helps augment the left side of the heart and helps give blood flow to the body. And augments meaning helps the left side of the heart, gives a little aid to the left side. That procedure involves, almost like when patients get bypass surgery, and involves what we call a sternotomy, which involves a surgical procedure, cutting the sternum open, and then we are able to implant this device in the area right by the left side of the heart, and then a little, almost like coaxial cable, almost like a cable you plug into your TV, exits the abdomen or the belly, and then goes to a brain of called a module, and called a control device, and that helps tell the pump what to do. And that is supported by batteries. And during the day, they're supported on batteries, and at night, they are on wall power to help keep the pump running and help the batteries charge. Almost you could compare it to an electric car. During the day, they're roaming around on battery power, and then at night, plug it in and ready to go again in the morning. It's not limited like an electric car where it's only a couple hours. This is truly 12 to 15 hours of support during the day that they can roam around on battery power and truly feel free and have the freedom of being able to go where they need to. And then at night, they kind of recharge overnight and ready to go the very next day. So when they meet with anesthesia and go under the sedation portion of the procedure, it's under 4 hours that they're done with the procedure. Some of it is making them sterile, putting them to sleep with anesthesia, and then you're talking about under 2 hours with the actual surgical procedure. And then after that 4 hours, they then close up and they go back to the recovery ICU. Typically, they're extubated that night and are able to converse with their family that evening or the very next morning. The actual pump is in the body. It sits right by the left side of the heart. And then there's a cable that tunnels through the belly and then comes out of the belly. And then there's a brain it's attached to, and then they wear 2 battery packs on the outside. So the brain and the battery power is on the outside, and the actual pump that's supplying the blood flow is inside the body. And because it's a mechanical body device, they require lifelong Coumadin or warfarin to be on board with this device. But truly the patient population this is for is when we think they're going to not do well in the next 1 year to 2 years standpoint. With those patients, we then do the mechanical heart pump. So we do specific tests. One of them is called a cardiopulmonary stress test. It's a fancy term, but we run them on a treadmill, and we are able to see, based on their blood pressure response and a host of other factors, it gives us objective data to know if they need this device. And those patients, when they truly need the device, if they don't get it within the next year, their mortality is greater than 50%. So truly, we're trying to use that device to prolong life, but also we prolong life and improve their quality of life. People no longer are getting short of breath going up steps. They feel back to their baseline where they're able to go up steps and have a good quality of life with this mechanical pump.